Okay, so we're looking at the ethmoid bone, and the ethmoid bone is what we have here. You know, this the bones up here, right? Okay, no, sorry. This one is the frontal sinus, right? Ethmoid is more of like close to your eyes. You understand? So the ethmoid bone, we'll talk about some reasons why we study this bone. So it's a delicate, it's a spongy bone, and it's located between the eyes, and it forms the part of the nasal cavity and also the anterior cranial base. So we study this bone because it could be affected by Ethmoid Sinusitis. So sinusitis is that bacterial infection there, which there's infection or inflammation of the ethmoid air cells. Okay, those are the paranasal sinuses within the ethmoid bone. So there's a lot of pain around the eye and around the nasal bridge, nasal congestion, and also purulent discharge. So there could be complications. Okay. So ethmoid sinusitis can spread quickly to the orbital intracranial structures. So it's actually a very dangerous condition. Okay. So cribriform plate fractures. So this is a cribriform plate. Okay, could fracture. So there could be fracture of it, mostly due to facial trauma. Okay, and you are having all this cerebrospinal fluid, rhinorrhea, anosmia, which is loss of smell, and there's risks of the infection spreading to the meninges of the brain, causing meningitis. Okay, so importance, these fractures are critical in trauma care and neurosurgery because they compromise the barrier between nasal cavity and cranial cavity. So the bone is also important in neurosurgery, which is basically, it forms part of the anterior cranial fossa and the medial orbital walls. It houses the cribriform plates through which the olfactory nerves pass. These are the olfactory nerves. Okay, so clinical importance is surgical approach to anterior skull base tumors, then also endoscopic sinus surgeries, and is also very close to vital structures, like the orbits, the brain, the nasal cavity.